This is CBS 12 News at 11.
If you want proof the economy is on the rebound, head to the plastic surgeon's office. New at 11, the latest numbers show cosmetic procedures made a sharp spike in 2010, rising 5% compared to the previous year. And more patients are opting for multiple surgeries. So why are most people going under the knife? Not a big surprise here. Breast augmentation. It is the most popular cosmetic procedure done in the country. A new technique I'm about to tell you about is billed as a more natural way to enhance your bust line, using your own fat and the stem cells extracted from that fat and injecting it into your breast. An Arizona doctor pioneered the procedure, and he's getting a lot of attention for it. But local plastic surgeons I talked to say proceed with caution. It's the most popular cosmetic surgery in the United States today. Almost 240,000 breast augmentation procedures were performed in the U.S. last year alone, and they always involve implants, until now. After having 4 kids, Brett Lee started thinking about breast implants, but
having something artificial in my body, going through the procedure, there were just too many things to me that was a little too scary for me.
Dr. Todd Mayland of Scottsdale, Arizona offered Brett something new, surgery that takes fat and stem cells from her problem areas, where she gains weight first and loses it last, and puts it in her breasts.
So I'm just going to go ahead and use this abdominal fat.
In surgery, the patient undergoes liposuction. The harvested fat is processed to extract stem cells. Then the stem cell concentrated fat is injected into the breast.
Once those stem cells kick in and they start growing that new blood supply, we start to see the breast enlarge and grow.
Yup, he said grow. And he promises a 1 to 2 cup increase. So I took this information to 2 local and well-respected plastic surgeons in our area and asked them about it.
I'm not sure that stem cells can actually make your breast grow.
Dr. Mark Pinsky uses fat injections to smooth out imperfections after breast reconstruction in cancer patients. But he says using them for breast augmentation is not mainstream and very controversial. He points to a lack of long-term studies.
There just has to be a lot more research done before we can say, let's go do this.
Dr. Luis Vinas agrees.
But you don't know what's going to happen with the stem cells as the years go by, 10, 15, 20 years. That's my big concern.
And he takes his concerns a step further. Remember that stem cells take on the identity of the tissue they're injected into.
The problem now becomes new stem cells, let's say, being injected around a cell that perhaps was becoming cancerous in the next few years.
So now you just gave it gasoline.
Exactly. You got it. Now you added the gasoline to make this cancer grow even faster.
As for the claims of a 1 to 2 cup increase, both doctors doubt it.
I will say a cup size is possible, and even that's stretching it. For 2 cup size, you may need to have maybe 2 or 3 sessions.
Dr. Todd Mayland says he's training doctors across the country in this procedure. I found 2 in Florida on his website. We have the link on our website, CBS12.com. By the way, stem cell breast augmentation costs between $15,000 and $22,000.